Hello guys, welcome to Medical Maniac. Today we are discussing about patient's consent. No operation or procedures can be done without patient's written consent. So before giving consent, all risks involved in the procedure should be disclosed to the patient. If a complication occurs, the possibility of which you had not explained to the patient may claim that if he knew such possibility, then he would not have consented. Of course, a remote, unforeseeable hazard or mishap cannot be told in advance. If the doctor feels, in his honest opinion, that certain information about the procedure may be physically or psychologically harmful to the patient, the doctor has the right to withhold such information. At the same time, explaining to the patient does not suffice. The consent has to be written and signed by the patient. Otherwise, it may not be considered by the law. Once patient has signed it, it becomes a documentary evidence, which is the best defense of the doctor. Even when a written consent is not taken, the doctor may prove that patient has consented after proper understanding. Example, implied consent. Consent may be implied from the patient's conducts, words or circumstances. Expose the buttocks for injection is like a consent given for injection. When child is brought to the practitioner by parents, the parent's consent is obvious. If a patient was given an appointment for a surgery and the patient had kept the appointment, his consent for the operation is implied. But in general practice, when a patient comes to the doctor, his consent to his examination and ordinary treatment, to the type of treatment, that is allopathic or homeopathic or Ayurvedic, is implied. But this consent does not cover procedures and operations. But implied consent has to be proved by the doctor. It is best that a written consent should be taken. In medical law, consent is important to protect a medical practitioner from liability for harm to a patient arising from a procedure. There are exemptions, such as when the patient is unable to give consent. Medical practitioner must explain the significant risks of a procedure or a medication, those that might change the patient's mind about whether or not to proceed with the treatment, before the patient can give a binding consent. Now let's talk about informed consent. Informed consent is a principle in medical ethics and medical law that a patient should have sufficient information before making their own free decisions about their medical care. A healthcare provider is often held to have a responsibility to ensure that the consent that a patient gives is informed. And informed consent can apply to a healthcare intervention on a person, conducting some form of research on a person, or for disclosing person's information. Informed consent is required for every invasive medical procedure, from getting your ears pierced to having an abortion. Thank you so much. Let's meet on another video of Medical Maniac. Thank you.